Homeopathic medicines for tendency towards recurrent or habitual abortion, threatened abortion. Caulophyllum Thalictroides and Helonias Dioica, effective homeopathic medicines for tendency towards recurrent or habitual abortion from uterine weakness. Caulophyllum Thalictroides and Helonias Dioica are top-grade homeopathic medicines for treating tendency towards repeated or habitual abortion from uterine weakness. Caulophyllum Thalictroides will work best where there is a tendency towards habitual abortion from uterine weakness and uterine atony. History of leucorrhea of acrid nature may also be present. Helonias Dioica will best treat habitual abortion where the uterus is weak, with a feeling of weight and soreness in the womb. During abortion, bleeding of dark, foul blood is present. Dragging in the pelvis may be observed. Other attending features include exhaustion, profound sadness, and irritability. Viburnum opulus, top-rated among homeopathic medicines for tendency towards recurrent or habitual abortion in early months, 1st to 3rd month. Viburnum opulus is one of the very significant homeopathic medicines for tendency towards recurrent or habitual abortion in the early months, i.e. between the first 3 months. Cramping pain in the uterus, which extends down the thighs, is observed. Women who need viburnum opulus may also have a history of late and scanty menses. The menses last for a few hours only. Offensiveness in menses is noted. History of leucorrhea of thick, white nature, often blood-streaked, may also be present. Sabina officinalis and secale cornutum, best homeopathic medicines for tendency towards recurrent or habitual abortion in 3rd month. Sabina officinalis and secale cornutum are significant homeopathic medicines for tendency towards recurrent or habitual abortion occurring in the 3rd month. Miscarriage is accompanied by bright blood mixed with clots. Along with this, pain from sacrum to pubis during bleeding is present. Women who need secale cornutum have a history of recurrent miscarriage with dark or blackish bleeding. There may also be history of brownish, offensive leucorrhea. Women prescribed secale cornutum have thin, cachaic, and feeble constitution. Apis mellifica, one of the top-grade homeopathic medicines for tendency towards recurrent or habitual abortion in 4th month. Apis mellifica is the most suitable among homeopathic medicines for tendency towards recurrent or habitual abortion in the 4th month. Bleeding during abortion in the 4th month, with soreness and tenderness in the womb, is a sign Apis mellifica will aid recovery. This medicine is also useful where there is a history of ovarian cyst with stinging pains. Case history will reveal short and scanty periods. Acrid, green leucorrhea at some point in the past may also be observed. Caulophyllum, homeopathic medicine for tendency towards recurrent or habitual abortion at 5 months. Caulophyllum is one of the most prominent homeopathic medicines for tendency towards recurrent or habitual abortion at 5 months. The symptoms narrated by women during such abortions include bleeding with back pain radiating down the hips and thighs. Caulophyllum will also show great results in treating weakness arising from the miscarriage.